We present you 3-Lock, Synthia Plus-Tech system for posterior stabilization. It is used to treat degenerative disc disease, spondylolisthesis, spinal instabilities, tumors, fractures, deformities, and spinal stenosis. The 3-Lock system comprises multi-axial and fixed dual-lead screws, hooks, rods, locking nuts, cross-links, and other optional components. Multi-axial dual-lead screws have a 30 degrees polyaxial range of motion and a double lead thread. Thanks to the double lead thread, it is easier to insert the screw. The stem has a conical start to friction on the pedicle and better maintain the position, a middle cylindrical portion and a conical end for a better positioning. Besides, the screws are self-tapping, top-loaded, and can be locked in just one step. They are made of titanium alloy. Multi-axial dual-lead screws are available with a 4 mm diameter and a length from 20 mm to 60 mm with 5 mm increment, and with a diameter of 5, 6, 7, and 8 mm and length from 30 mm to 60 mm with 5 mm increment. There are also fixed dual-lead screws, available in the same dimensions and having the same features of multi-axial screws. The hooks are available in different versions and dimensions. Thoracic, for the pedicle, with narrow, wide, or angled blade, and they can be used in different conditions. The rods have an hexagonal end, so the positioning is easier. They are made of titanium alloy or of chrome cobalt molybdenum, and are available straight and pre-bent. The diameter is 5.5 mm, and the length varies from 40 mm to 500 mm for the straight rods, and from 50 mm to 90 mm for the pre-bent rods. The locking nuts have a tightening torque of 9 Newton per meter and a square threads that maximize thread engagements. The crosslinks are available in different sizes, fixed from 15 mm to 48 mm with 3 mm increment, and modular. Modular crosslinks are designed to cover all the lengths between 30 mm and 70 mm. Among optional components, there are the multi-axial dual-lead reduction screws. Also, this kind of screws are available with different lengths and diameters. The 3-Lock system has several advantages. Being top-loaded allows to have a few components and an easier connection between the rod and the screw. The square threads of the caps, the tightening torque of 9 Newton per meter, and the fact that it is locked in just one step guarantee a low force and so the safety of the rod. Thanks to the hexagonal end of the rods, it is possible to adjust their position easily. The dual lead thread of the self-tapping screws, together with the conical tip, allows a faster insertion. It is shown here the correction of a severe scoliosis thanks to 3-Lock system. There is a standard instrument set for the screws and a dedicated instrument set for the hooks. The first step of the surgical technique for implanting the screws consists in the pedicle preparation and the use of the top. The screws are then inserted into the prepared pedicle after being positioned on the screw holder. It is possible to bend the rods before and after the implant. Once the rod is correctly positioned, the cap has to be tightened using the 9 Newton per meter dynamometer and a counter torque tool. Before completely tighten the caps, it is possible to compress or distract using compressor or spreader. Then the surgeon has to determine the appropriate crosslink size with a caliper to place the crosslink and tighten the crosslink nuts. The procedure for implanting the hooks consists in pedicle or lamina preparation, hook loading on one of the implant holders, hook insertion, and nuts tightening. If the rod is not perfectly housed, it is possible to correct its position using a persuader. Also, cannulated fenestrated screws are available in order to optimize cement flow into the vertebral body. The sacroiliac system, which is fully compatible with all the other 3-Lock components, is available in different sizes and guarantees a rigid and low-profile fixation. There are also screws with a diameter of 9, 10, 11, and 12 mm, suitable also for iliac fixation. The uniplant screws have a strict motion in the mediolateral direction. For this reason, they are particularly indicated in complex deformity cases.